Hello and good evening and welcome to this webinar. My name is Sarah Pinch and I'm the Managing Director of Pinch Point Communications, and we have been absolutely delighted to be supporting the North London Mental Health Partnership with the work to pull up the walls of the prison and see what it's like to work in mental health within the prison service. So this webinar is Behind the Prison Wall, a day in the life of a mental health nurse. And we're absolutely delighted to be welcomed by two colleagues from the North London Mental Health Partnership, Bola and Jonathon, and also by Dr. Liz Walsh from the Royal College of Nursing, who've been absolutely instrumental in supporting this webinar. So before I ask them to introduce themselves, just some housekeeping rules. We're really pleased that you're here and thank you for taking the time out from your evening. Please ask any questions if you've not managed to submit them in advance. We're looking forward to seeing them, and you just do that by popping them in the Q&A function. We will try to answer as many as we possibly can, and we will share the recording with you afterwards. On the end slide of this webinar this evening, and also in that email, will be email addresses for you to contact to find out more. So first, Liz, if I can come to you and you can just tell us a little bit about yourself.
Yeah, hello everyone. Lovely to see so many of you here. So my name's Liz Walsh. I'm currently the UK professional lead for Justice and Forensic Healthcare at the Royal College of Nursing. But my journey in this space started in 1995 when I qualified as a general nurse. I went straight to work at Wormwood Scrubs Prison as a newly qualified nurse, having had two absolutely brilliant placements during my training. So while I was there, I started to wonder what I was doing there and what nurses doing in prison. So started to do a master's degree looking at the role of the nurse in prison. I then went to London South Bank University with a joint appointment with the London area office from the prison service to do practice development across all London prisons and work with students at the university at the same time. I moved in higher education jobs, Bournemouth University, to look at research in prisons. Then I went to Leeds University to be an associate professor in offender health there, carrying on with practice development. Following that, I went to work for HM Inspectorate of Prisons as a health and social care inspector. And via working in the independent sector after that as a lead for practice development, I now find myself at the Royal College of Nursing. So it's mostly been clinician, researcher, educator, a bit of everything. So that's why I'm here now.
Thank you, and thank you for joining us this evening. Bola.
Hello, everyone. My name is Bola Odesola, and my journey in nursing started when I qualified in 2005. And I work with South London Mostly Trust in the acute mental health. Around 2010, I ventured into prisons, which I've done a couple of agency work in most of the prisons, and also work in young offenders. And I joined BH about 2020. And I also left. I worked with them for 2 years, went to work for another company and came back again. And I'm currently the modern matron for the London prisons. And I've done some external courses in management as well. Yeah.
Thank you, Bola. Jonathon.
Hello, my name is Jonathon Stephen. I'm the Senior Service Lead for Health and Justice with Barnet Enfield and Harrogate Mental Health Trust. I've been working in mental health since 1995 when I started my training. Prior to that, I was a healthcare assistant in an LD hospital, but also looking after people with dual diagnosis with mental health needs. Have made me go in the direction of doing my nurse training in mental health. I was always interested in mental health issues, and I really enjoyed my training. I was fortunate enough to work as a mental health nurse from 1998. Started off in PICU, worked in acute, And then I drifted into community mental health care, secondary adult, looking after people with complex needs, and usually as a CPN in that era, I would get the caseload of people with schizophrenia, all the big blokes. And then drifted into management, but I've also retained my mental health and nursing registration, and I've been really blessed in my career development. I've worked across most areas of mental health, older adults, CAMS, IAPT, and so pretty much the whole pathway. And about 5 years ago, I had an opportunity to move into an operational role in forensic care, and I had been the MAPA lead in Barnet for a few years, and it really stoked my interest in forensic care. And so I grabbed the opportunity, and August 2019, I came over to the Specialist Services Division within BEH, and prisons is part of the work I do. I also look after liaison diversion services, substance misuse, and a few other really interesting niche areas. But today we're here to talk about prison work, and it's been an uphill learning curve for me over the last 5 years, and I'm still learning. But it's a really fascinating area to work in, I think, and we're really blessed with the services that we have in BEH, and the clinicians and the teams there. They're fantastic.
Thank you, Jonathan. And you mentioned in your response there are a number of acronyms, so I'm going to make a little plea as we go on through the webinar to try and explain some of those as we go, because we fall into those so easily within the NHS, and they're not always understandable. So I might interrupt you if you fall into using too many of those, guys. So try to just explain what we mean. But I'm really interested that you all started in a very different place to where you've ended up, and I think in the 18 or so years that I've worked in around the NHS, that is a constant, is that people start doing one thing and might move on to do something else, either in the same area or in a very different one. And Jonathan, if I might come back to you, you said you started as an HCA, so a healthcare assistant. What prompted your interest in nursing from that role?
Well, I worked as an HCA for about 2 years, and I really enjoyed the work. I really enjoyed developing relationships with the MDT, with service users, with complex vulnerabilities, and you have a key role, a pivotal role in influencing change in people's lives, sometimes providing hope and containment and support in people's darkest times, and I really enjoyed it. So I just thought, right, I've got to do this, or I could stay as an HCA, I suppose, but also had a young family starting, so I became a bit more ambitious and wanted to move beyond and learn and develop. So yeah, I was really fortunate in getting onto the nursing course and achieving my qualification.
Yeah, and Liz, you talked about doing some placements and then going into prison to be a nurse. Those placements are or can be incredibly important, can't they, when you're first starting out?
It was great because I got an insight into how everything worked, and it was so different to the places I was having my placements as a student, and I just felt at home. It really is. I'd sometimes think it's a love it or don't love it situation, and I just felt at home working with this group of people and the staff as well. I was made to feel so welcome, and it was nothing like I expected, which won't surprise people who work in prison. When you get there, it's actually not what you thought it was. So no, those placements were pivotal to my decision to go and work in prison. Was getting that experience and that first-hand experience to actually work there. Yeah, that did it for me.
Thank you. Now, Bola, if I can come to you. Now, you and I have spent some time together in one of the prisons where you work, and I would absolutely echo what Liz has just said about the welcome and the team spirit. Can you just tell us why did you choose to work in forensics?
When I was doing my training, because I did my training in University of Greenwich, and I happened to do a 3 months placement, a forensic placement, and that was in HMP Benmarsh then. And I really loved the environment, and my mentors were two young African men, and they were planning to go to Canada then. They were migrating, but they really, really helped me and even supported me well in my, and I also opened and had a great insight into how prison work. But at that time, we were told, oh, they can't take you directly after qualifying, because that was my last management placement. So I had to go to SLAM. Yeah, I had to go to South London Mostly Trust to work there for about 3 years to do the acute mental health, where I developed my skills in most of the nursing skills. Yeah, so where I did a lot of, I work in the CAMS. I ended up working with
So that's the
in the
children
admission
and
unit. Yes,
children
in the
and
admission
adolescents mental
unit.
health.
Yeah, yeah. But during my placement, I had a passion, towards supporting in rehabilitating people that have been marginalized due to their criminal behavior and activities. And I also had that passion, and I also had passion of maybe instilling hope and values into people, just to help bridge the gap that between their offense and who they are, that where they might have committed a crime, but there's still a personality behind the crime. There's still a nice person, and it's just about giving people a second chance. And that was what drove me back into prison work. That was around 2010, and I've stayed in prison up to now till then, and which I really, really enjoyed. Yeah.
Thank you. And Liz, you've done some research, you've done a PhD, no less, into some of those challenges that Bola's just touched on there. And we know from some of the questions that people have asked that, one of the real questions is around how do you care for someone who has committed a crime? Now, often, well, I'm not going to answer the question for you. Why don't you share with us some of your insights into how that works for nurses?
Yeah, okay. So my research was all around the concept of emotional labour, and how you can look after people who other people would find really difficult to care for. Nurses who work in prison are repeatedly asked, I don't know how you care for people who have murdered or whatever. So I decided to try and find out. And having been one of those nurses, a lot of the time you think, well, I don't think about it. They're just another patient. So I went and spoke to people who were looking after high profile prisoners where they couldn't not know what these guys had done. And for me, it's all around acknowledging that and acknowledging that it can be difficult. We like to think we're non-judgmental. That's how we behave, that's how we practice. But I do think at some point when you're looking after some guys, it can be quite difficult to be non-judgmental, because sometimes it can be just a natural reaction, and we're all human. My concern is when people don't acknowledge that and pretend like nothing's happening and that they're fine. So my concern is with prison nurses is to make sure that there's support there and that people are comfortable to say when they're finding things difficult. It doesn't make you a bad nurse. It just means you're a real person with feelings. And there are systems and processes in place and services in place to support nurses in those situations. And my work kind of has contributed to how we develop those services and what those services need to look like, whilst giving nurses who work in this setting permission to feel those things, because it is difficult to care for people who have done some horrific things. And Bola, you'll probably agree, I don't know, that there are certain things that will get you annoyed, and there are certain things that won't bother me but may bother you. So then it's about working as a team, and it's working with your colleagues to say, do you know what, I'm finding this really difficult. Could someone else do that? And it's about acknowledging when it is difficult, without believing that you're in some way a bad nurse, because actually we're all human and something that I often use is an analogy around so when you're on an aeroplane and cabin crew come along and they tell you to put your oxygen mask on first before you stop to help anyone else. And that is with the message I give people, is you've got to look after yourself before you can even begin to help others. And managing the emotional labour of caring for people in prison is really important, and it's important to acknowledge that. Did that answer your question?
It did, and I think that's a really clear analogy, that of, you know, making sure that you can breathe and you can carry on before you help others to do that from the aeroplane. So thank you, Liz, very much for that. Jonathon.
Sorry, just on that point, I suppose, when we think about this issue of, how do we sustain our clinicians in an environment which is particularly challenging and complex, both in terms of your caseload, but also in terms of our ability to treat people. In a prison setting, people need to volunteer to accept treatment. So we have people who may not have the communication capabilities. They've experienced complex multiple deprivation in their longer term histories. So our challenge is to engage with individuals and create relationships, create trust, and create pockets of hope for people who may be in quite hopeless situations in terms of the longevity of sentence, or they may be in very uncertain situations because they're remanded to prison and they don't know what's going to happen in the future. So I think it's of utmost importance that we have the support in place, and I think we do a pretty good job of it within BH. Within our prison services, we've got reflective practice for our nursing teams. We've got individual supervision. We've got ad hoc support. We've got post-incident support, and also I think we're compassionate as a leadership team. We've got a wealth of experience in our clinical leads, our psychiatrists, our psychologists, our therapy colleagues, and our nursing colleagues, many who've accumulated many years of working on the cold face in this environment. So I think we can always improve how we support people proactively, but I think we've got pretty good systems in place. And Bola, I think is testament to that. Years of wisdom working in a prison, in various prison settings, and offering support to team colleagues.
Thank you. And Jonathon, and that might be the answer to this question actually, but what is the one thing that you would want people to know about working in the prison service as a nurse?
Oh, I'm going to give you more than one, Sarah. It's not going to be one. It's too big a question. First of all, it's not the scary place that people might anticipate it to be. It's a secure setting, and it's very well. It's designed around security, with the prison, the prison staff, with the structure of the environment. So it's not the scary place that you'd expect it to be. And in terms of risk to individuals working in a prison setting, it's really quite low. In our settings, the number of incidents, against staff compare remarkably favourably to the things that people experience in acute settings and inpatient settings. And that's because there's a high prison officer presence. So anybody who's risky, it may present a risk to other people. There's tight regime control on those individuals. So I do think it's not the scary place that you'd expect it to be. It's much more sort of warm and friendly as well, than you'd expect it to be. When you first go into the environments, it's oh gosh, I remember my first visit to the prison about 5 years ago. Promise it was my first visit. I was quite surprised by how old the environment was as well. It's not a modern environment. The prisons are Victorian buildings, and what I felt more than anything was that it was actually a bit of sympathy for the residents, and also for the prison staff having to work in a really challenged physical environment. I'm continuously surprised by the quality of the relationships, the therapeutic relationships that we create, that add benefit for residents in really difficult circumstances. So I think the opportunity to engage, to have meaningful impact on people's lives is there, and I think people may not guess that could be available in a prison mental health care setting. But I think the rewards are really significant for clinicians. So that's the big one message I would say. If you haven't been into a prison setting and you're curious, get in touch. We'd love to meet you and maybe arrange a visit. And there are we have jobs available. There are vacancies out there, and you don't need to come in knowing being a prison expert. You can get in contact. We'd be really happy. If you've got your core assessment skills or your core nursing abilities, then we can support you to develop into role which is specific to prison settings, but in a context where you've got loads of experts around you. So
yes.
So I think there's lots that we can offer. I think in our prison settings. We have just redesigned the service over the last sort of two and a half years. We've gone through the development of a new model of care, and it's a really integrated model. So so we work with substance misuse services, physical health care, and prison colleagues, and we all come together frequently to share our approach towards managing service users. So it's a really high quality multi-agency process. We've got good acute provision running 7 days a week. We managed to achieve quite a significant additional investment into the prison settings, and that investment was tailored around the vulnerable areas, which is when people come into custody, which is when they're really vulnerable. So they need good assessment at point of entry, and also they need a responsive service for when they're reaching a point of crisis. And so we're able to expand our what we call now unscheduled care, which is equivalent to community crisis provision.
Yeah.
So yeah, I think it's a well-formed model of delivery, and underpinned by really great team ethics. So yeah, come and get in contact if you're curious.
Thank you. And we will share the email at the end of the webinar for people to be able to do that. Bola, can I ask you, on a very practical level, what does a day in the life of a nurse in the prison service consist of?
Well, a day is not always the same. Because as it come in, depending on what is happening. And as Jonathon had said, we've now devised new models of care, which means nurses work in different pathway. You've got the early days in custody, which is like the A&E format. Everybody that comes in comes through the system. There's a nurse that will assess their mental health needs. We've got the crisis element, which we allocate staff to do that part. And we've also got the plan, which is the case management, where you look here. So on a daily basis, depending what is happening, you've got nurses that are located to do the crisis team, which they respond to situations happening within the prison. So so you've got that. You've also got we've also got group of nurses that are doing assessment of the new receptions that come in to be able to assess their needs, and we tend to place them in the right pathway. So on a daily basis, depending on what is happening, we'll respond to what is happening on air. But every day is always different. There are days that is really quite busy and very chaotic, and some other days is a bit quieter. But the essence of working together as a team is the most paramount thing within the prison service. Everybody works together like a little mini family to support each other, and that's what makes the job interesting. Yeah.
Thank you. And
I think,
Liz,
Sarah,
sorry, Jonathan.
Maybe just to expand on that a little bit, we in our prison settings we have different teams, as well as the core sort of mental health hub teams that Bola was just describing. We also have inpatient teams in Pentonville and Wormwood Scrubs. And it's not really a hospital because we don't have the same sort of powers to treat, but it's more intensively staffed, people with greater vulnerabilities and greater presentations of illness or significant risk to self, or others, or very significant self-neglect may be admitted to that environment where they can receive better physical healthcare and mental health care. So you would have more of a traditional sort of nursing, similar to an inpatient nursing role in that part of the service. But yeah, it's so yeah, there's that. Those options are available as well.
Yeah.
So by inpatient service, you mean something that would be familiar to people? It would look a bit like a ward, really, in a hospital,
Yes,
but in the
please.
prison. Indeed.
Yeah.
Okay.
Yeah.
That's
Yeah.
helpful. Thank you.
Yeah.
Liz, you've talked about the challenges and the need to be really human and open to that of caring for people who have committed crime. But how does it feel to work alongside people who literally have no freedom and may feel quite vulnerable as a result of that?
I found it sounds really cliche, but I found it was so rewarding, because these people are vulnerable and are perhaps having one of the worst times of their lives. And like you said, Bola, it's about instilling hope. It's about supporting people. And often patients I looked after hadn't had anyone care about them ever. So to actually have somebody who was bothered about them and cared for them was new to them. And I found that quite a privilege to be that person who could actually do that. I think the other thing for me was, because I was used to coming from placements in general adult wards, because I'm an adult nurse, and there would be tons and tons of chocolates and thank you cards and all sorts of things coming in. But in a prison, there was none of that, and that's absolutely fine. So when we did get the occasional note written to us to say thank you, it was like, oh my word, I have made such a difference to that person. It really meant something. It was so significant. So to be able to have that impact on people's lives is quite something. But I think the other thing for me was, I knew that we were also having an impact on patients' families and the community that they were being released into, because there was that kind of other layer to our work by virtue of the fact we were caring for these guys. So for me, I mean, it does sound really cliche. It's very, not all the time, but a lot of the time, hugely rewarding, and such so many learning opportunities I found. Because as a general nurse, I was working alongside my mental health colleagues and learning loads. And likewise, it was around the other way, and similarly with prison officers. So I got to learn an awful lot. It's a very rich ground for learning and professional development that you wouldn't get outside. But yeah.
And Jonathan's spoken a bit about safety, but did you ever feel unsafe when you were working in prisons?
No, because like Jonathan was saying, it's set up to be controlled.
Yeah.
It's very, very well controlled. So much so that it's very rare to feel unsafe in a prison. I was only assaulted once in my whole time working in prison, and that wasn't really malicious. It was a gentleman with dementia. But the way that other prisoners reacted to me being assaulted was also quite something, because they were quite upset about me having been put in that position. So I would say that it's probably way safer than working outside a prison, because the systems are there to support you should anything happen. So I've never felt unsafe in a prison.
Thank you. We've had a few questions about qualifications, so I'm going to ask them, and then perhaps whoever irony intended, feels, or pun intended, I should say, feels best qualified to answer them, can answer them. So a couple of people asking about what qualifications do you need to come and work in prison as a nurse? Do those qualifications need to include a degree? And if they do, what kind of degree do you need? So I don't mind who starts about the more general question around what qualifications do you need?
Thanks. I mean, I'll field that. I mean, you need to be a registered mental health nurse. Generally speaking, for our band 6 roles, I mean, we're talking about nursing roles, so this is about, you know, having a nursing registration qualification. So we have a range of different roles available for newly qualified nurses, band 5, who we could train up and develop into band 6s. And then we also have roles at band 6, which where we'd be looking for somebody who is, you know, who has their basic skills and abilities, probably has, you know, a year or 2 post qualification experience. Doesn't need to be in a secure setting, doesn't need to be in a prison setting. If you've got the core assessment, you know, the empathy, the right values, then, you know, we're really happy to train you up. I mean, what we're working with in our prison settings is people with mental health needs and mental health related vulnerabilities, and it's the same sort of content, but in a different context, of somebody being, you know, forced to be in an environment because of offending behaviour. So the core skill set is, you know, can be applied to the client group.
There's a transferable set of skills there,
Yeah.
Jonathan. Yes.
Exactly.
Yeah.
Exactly.
Yes.
You know, we want first and foremost compassionate nurses, energized nurses who genuinely want to see the person there and
Yes.
understand that person's journey with sympathy and empathy, and somebody who can generate hope for an individual. But we also want somebody who's good at assessment, good technical assessment skills. We can train people up in that as well. You know, we do have lots of training available for our workforce. You know, we're particularly interested in influencing the culture of healthcare provision in prisons, and moving towards a trauma-informed set of footings for how we work and how we think and behave in our prison settings.
Mm-hmm.
That's not only for us, but also, you know, we're also developing trauma-informed strategies, which are multi-agency in our prison settings, and we're leading on those. We really think it's instrumentally important that we understand and think about people from the point of view of what is their trauma history and how has that affected their lives to reach this point, and how can we support them to understand that. We have training available in neurodiversity, ND assessment, autism assessment. Yeah, we're very interested. We will have work with people with psychosis, of course, as well. So I'm just aware my lighting's gone a bit funny. The sun's come around to the front of my house. I'm just going to change the blinds for a second. So yes, there's loads of. I've got stripes.
No worries.
There we go.
And what about at the other end of the spectrum? So Liz spoke about the importance of placements. We've spoken about students. If there are some students with us this evening, if they're interested in a career within the forensic service, what advice, Bola, would you give to someone who's coming, you know, maybe thinking about a placement like Liz was?
Yeah, presently at the moment, we do have students that come and do placement within our prison service. And as I've said, I had the opportunity, I think towards the last year of most nursing career, towards your last degree, you've got an option of doing management placement. And any student, yeah, is well free to maybe choose prisons, yeah, and just contact, yeah, and this is always done through the placement office, so they can contact the prisons for the
their placement office in
yes,
their university.
Yes, and they can contact us, and most of our nurses are also trained mentors. Yes, so they can help them to, yeah. So it's a very
And
good place for students.
What about nurses who are newly qualified, Jonathan? What opportunities, if any, are there for those nurses within the forensic service at the moment?
Well, much as you would think about, sort of a traditional route for somebody going into secondary mental health care, that would most often be, you'd get a job in an acute inpatient setting as a band 5 and follow a preceptorship process to build up your skills and knowledge and then be uplifted to a band 6. We have these opportunities in our inpatient settings. They are limited in number. We have a finite volume of vacancies, but they are. I think we have vacancies at the moment. So, if people are interested in finding out, make an application, or indeed get in contact, and if you'd like to visit the environments, we can facilitate that. So you can dip your toe in the water and really get a feel for what it's like within the prison environment.
Thank you. And Bola, how about if you were a registered adult nurse, maybe working in the community or maybe working in an acute hospital, and you wanted to transition from a more general post into a mental health nurse post? Is that a possibility?
Yeah, I think Liz will be able to talk much about this, but I can know that, yeah, I think most adult nurses, they can do like a conversion course. I think there's a conversion course for about 18 months to cross over to the pathway of mental health. And at times, in most of our trusts, we also have some nurses that are maybe physical health trained that they tend to work within the mental health team. But I think within there is a pathway for even conversion for general nurses to mental health nurses.
Thank you. Liz, do you want to add to that?
No, I was just thinking, so there's primary mental health need in prison. And I know that some general nurses who work in primary care will address some of that primary mental health need. So in terms of the mental health team, that's different. You would need to be a registered mental health nurse. But there is exposure to mental health need for adult nurses who work in the primary care teams in prison. So that's one of the joys of working in prison, is you get to see other bits of specialty that you wouldn't normally get to see.
Yes.
Yeah, we don't provide the primary care physical health services in our prison settings. We do offer training, and we work very closely with the team. In our inpatient units, we have dedicated sessions from the physical health care team into our which is primarily a mental health care environment, but we also recognise there are people with physical health needs, so we have dedicated time coming in. I mean, if we have people with dual qualifications, we'd obviously be really welcomed in that sort of environment. But we do need the core mental health qualification in those settings. They have primacy. And so that's the way the service is designed at the moment. We have that input from a specialism, which is commissioned differently to our service.
Yeah. Can I just pick up on something you said earlier about students and placements, and you said about dipping your toe in the water. And I thought, yeah, that's really important, because students who are on placement in other areas where there are links to prison, it's a really good idea to take advantage of that link while you're on a placement, so you can go and see what happens without having to do the whole placement in a prison if that's not what you want to do. But you can get that kind of taster. And I think that's really important, because it's not the kind of place that it's good to have a taster, is what I'm saying. And there's opportunities for that.
Thank you, Liz. You've touched on, all of you, I think, this opportunity to work as part of a bigger team, both the team that Jonathon and Bola work in terms of the mental health team and the different roles, including nursing, but psychology, speech and language therapists that are all part of that, but also how the mental health NHS team, if you like, crosses over with the third sector support, the prison officers and staff themselves. Can I ask one of you just to talk a little bit about the teamwork that goes into supporting patients in prison right across the piece, and perhaps the uniqueness of that you wouldn't get as a nurse in another environment?
Yeah, I think what we see in our prison settings, and Bola, you might want to add to this, but
Yeah.
especially with the new model that has been introduced, is we see a full commitment for multi-agency process, and in prison it's really critical, you know, for especially people who are acutely unwell and acutely vulnerable, that we come together and share perspectives and share and advice, for example, from a mental health perspective, on how to interact with somebody who's potentially at risk, to influence what level of care and support is needed. And so you'll see a far more integrated approach there, because you've got all the agencies in the prison setting, and you've got them all committed to these processes. So one example of that would be the MDT, multi-agency meeting. Come together, you talk about a case, and you've got chaplaincy there, you've got the representative from the wing, you've got, and that'll be a prison representative, then you'll have a mental health representative, you'll have a substance misuse service representative, and you'll have a therapies rep, maybe psychiatry if you need it. It'll be tailored to the individual context. So we see much safer processes and full, decent information sharing to optimize people's safety. And it's a very impressive multi-agency approach. And obviously the resident at the center of the process. We're trying to empower, trying to empower them to choose their, the healthy options and engage. It is double-edged. I mean, you've got to acknowledge that people aren't always effectively treated in the prison setting, and some people are waiting for treatment. So they'll be on a pathway waiting to transfer for a hospital placement, and there can be delays for cases in these circumstances. So what we do in that interim period together is so critical to try and keep people safe. The quality of what we do, the quality of the information sharing, the quality of containment, of having a shared narrative, non-punitive, non-judgmental shared narrative, is really critical. So yeah, I think there's that you see lots of routine multi-agency work, and then you see really sharp end stuff, it's all very impressive.
Bola, do you want to add?
Yeah, especially in an inpatient setting, the integrated work. Yeah, you've got the officers, you've got the multi-agency, different people coming in just to ensure that a patient, just to ensure that a prisoner is safe. Yeah, and everything, and one thing that the prison has also put in place for us, which is a good supporting safety mechanism, is if a patient expresses maybe self-harm thoughts, there's an act process just to maintain the patient's safety, and you have the multi-agency staff, from chaplaincy to the prison officer himself to the substance misuse, and everybody contributes towards the safekeeping of that patient, and that has really helped to support the prisoner a lot. Yeah, the interagency working is very, very strong in prisoner. Yeah, and one thing that I've noticed is that for us to even care for the patients properly, you need the support of the prison officers. So we have to work closely with them just to make sure, because just to make sure for us to be able to carry the interventions properly, we need the contribution of the prison officers. So we tend to work slow. We tend to work closely with them.
Yeah.
I mean, it's probably worth ACT as assessment, care and custody and teamwork as a process for those people who don't know about it, and it is a multi-agency care planning process for people who are at risk. Anybody can instigate it, an ACT process, and it means all agencies are obliged to get on board, participate in the joint care planning for an individual to work together to mitigate risk. So yeah, it's very robust.
Can I ask a question about preceptorships? Do you offer those, and would you recommend that for a newly qualified nurse who is interested in mental health?
Yes, we do offer preceptorship. Yeah, we do. Yeah, any newly qualified nurse, maybe starting from band 5, is done in the mental health inpatient provision that we've got. Yeah, and we've also got band 6 and also the team manager that can support the staff. Yeah.
Excellent. Thank you, Jonathan.
I think you're going to get good exposure to a whole range of people with diverse and complex needs, just as you would in an acute setting. So it's a good place to cut your teeth on learning. You're going to have people with complex physical health needs. You'll have people of all age ranges. So yeah, you can learn an awful lot there. In that environment, but also, I suppose it's worth thinking about. We're one part of a very large organisation of mental health provision, Barnet Enfield and Harringay Mental Health Trust. We're moving into a partnership with Camden and Islington in the near future, where we're going to become a new organisation together. And the broader opportunities in our division alone, which covers prisons, we also provide low secure, medium secure LD provision, substance misuse, liaison diversion, personality offender pathway provision in prison and also in community. And that's just our division. There are loads of career opportunities and development opportunities for people to come to work within our organisation more broadly. And then, of course, you've got the broader services in BEH and CNI and also the resources of this large organisation.
Yes.
And we recognise our service is all about our people. Without our people, we don't have a service. So we want to develop people, and there's a huge menu there.
And so there's something about, isn't there? I think what we've been talking about this evening, which is, yes, there's an enormous amount of opportunity within forensic services, within prisons, but it's part of this much bigger organisation where you can also go and get other experiences and have other learning and development opportunities. Liz, I wanted to ask you a more general question about mental health support for nurses, because any environment that you're working in as a nurse is pressurised and difficult and challenging, but in a prison, you are also perhaps at times, although the teamwork we've heard about is incredible, what additional support might a nurse be able to access when working within the prison service?
So I guess locally, like we've already talked about, there is a reflective practice, there's clinical supervision, there's this incredible team working that's quite something. I suppose from my perspective, I would talk about the support that's available through the Royal College of Nursing. So I'm the UK lead for Justice and Forensics. So for a lot of people will think the Royal College of Nursing is just a trade union, but it's a professional body as well. And there are professional leads working there, addressing professional issues and supporting members with working in particularly challenging places. So I suppose at the RCN we have a Justice and Forensic Forum with over 3,500 members who work in these settings. There's an awful lot of resources, there's a lot of support through our organisation for nurses working in these areas. So there is local support, but there is also support through the Royal College of Nursing as well. But I would suggest clinical supervision, reflective practice, and actually looking for support that will work for you. It is so important in this field.
Thank you. And I think that work that the Royal College or those that support, I should say, that the Royal College offers is an additional opportunity, isn't it, to talk to colleagues working within the profession, but in different areas, sharing experiences, learning from each other, as well as that which is available locally. Jonathon and Bola, I wanted to ask you a question about professional development within specialist services within your organisation, particularly around perhaps areas that people might not have needed support with. So Jonathon, right at the beginning, you talked about language barriers and caring for people who've come through very serious trauma, and language barriers not necessarily meaning they speak a different language, but actually they may have difficulty speaking, communicating. Can you just talk a little bit about some of the things that you offer for colleagues who may be struggling with some of that?
Yeah, I think we have a range of different opportunities. I think we have in our new model, we've created speech and language therapy roles. So they would be the primary experts on supporting individuals to overcome communication barriers, whatever the cause of those may be, whether it's neurodevelopmental, educational, organic. So we're recruiting to those roles at the moment. We have lots of them occupied. So we have the guidance and support of experts, and also the opportunity to access expertise to work individually with people who have communication difficulties. And communication difficulties are prevalent for our client group in prison settings, where people may well have been had restricted access or not so much social support in growing up, and may not have developed a language that enables them to describe their needs in good detail, or may not have written capabilities. So we have to work very carefully with this client group and try and support them to navigate their journey with these difficulties, which are environmentally. It's similar. It's any other disability. It's environmentally defined. So we have the expertise of SALT, but we also have core training available. So we have autistic ASD training available for clinicians, nurses included. We'd also be putting in place, and we have available trauma-informed provision as well, trauma-informed training for our workforce, and we had we did want to include LD nurses in the makeup of our workforce, but we really struggled to recruit to those roles. They sat empty for many years, and so we rely on therapy staff to develop specialisms and to support all of the team to achieve sort of minimal competencies with people who may have various causes for communication difficulties. So the support's there. We've got very well-resourced therapy teams in our service. So that's psychology, OT, and speech and language therapy, and then also obviously some counselling resources as well. But there's a wealth of expertise there to support people to work with cases effectively. So we can do some core training. We can also do specialist training and fund additional training where there's a need to do so. And we're always open to hear from people around, how do they want to develop their careers? And we look to fund things that are needed within the service. We've got great relationships with commissioners as well. So we've recently got the go ahead to procure ADOS training for all of our staff, and also to put a sensory room in place. So where there's a clinical need, we have a really responsive answer often from commissioners. So yeah, it's really heartening to see that where we don't have we don't have the essentials built in, we can ask for it and often secure what we need.
Thank you. Do you also offer IT assistance at all? I just left and now I've come back.
Oh, I didn't notice. I was waffling.
I shan't take that personally, Jonathan.
You must have frozen. I thought you were just being attentive, Sarah.
Always. Some very specific questions, if I may, about have you got a job for any band 5 students that are qualifying in September?
There are band 5 vacancies. I think we've put them out today. They've gone live. So I think they've been issued. I wonder if we can share those with all attendees. Would that be possible?
Yes, of course. Yes, of course we can do that.
And should those routes of application not be successful, please get in contact. We'll put you in touch with the ward manager and you can arrange a visit. Come on in, have a look.
Brilliant. And I think that's a really important thing that we've sort of mentioned in passing, but that we definitely want to offer the opportunity for people to be able to come in and have a look. And as you know, Jonathan, you said it was 5 years ago you first visited a prison. You know, it was probably 5 months ago that I first visited a prison, maybe a little longer, Bola, but that sense of welcome and that sense of safety, as someone who's never been involved in prison work, I can't overemphasize, actually. Someone was asking, and you may have answered this whilst I was momentarily concentrating very hard, but about support for deaf patients. I'm presuming, Bola, within the multidisciplinary team, you have people who can assist patients who have disabilities, additional disabilities.
Yeah. Within inpatient facilities, depending on the disability of the patient, sometimes if they've got physical disability, they tend to be relocated on the inpatient wings for support. And also our primary health care colleagues tend to have like a personal support plan with outside communities that come in to look at, to support, older adult prisoners that need some, that need some support caring. The physical health counterparts do that.
Now we promised we'd finish on time. So in the next 3 minutes, I'm going to ask each of you for a one, and it needs to be one sentence, Jonathan, one sentence on what advice would you give to a nurse wanting to work in a prison? Bola.
I think an advice that I would give to a nurse wanting to come here, and I'll look at it from the personality, is just for the person to be caring and genuine. Just to care, because that's what the prisoners tend to want. They want someone that is genuine. Someone that is actually caring, not someone, just for you to be yourself.
You said to me when we met to record your film, and if people on the webinar haven't seen some of the films that have been on social media, I would encourage you to have a look. But Bola, you said that sometimes, you know, you're meeting someone at their most vulnerable and no one has cared for them before.
But what tends to happen is that working in prison, it opens your eyes, because, you know, they always saying that men don't cry. Men don't cry, but there are times that you come across people that their lowest ebb, completely lowest ebb, and they are crying. And you need to offer hope, you need to reassure them and tell them that, look here, tomorrow is going to be okay. And that's what they just want to hear. It's just the genuine that, look here, this person cares, and that tends to go a very, very long way to people.
Okay. Liz.
I think if I'm talking to people who are thinking they might like to work in a prison, then I would encourage people to don't rely on what you think you know about prison. Don't assume that what you see on the television, in the media, and what your family tell you is what happens in a prison. Yes. It's really important to go and find out for yourself and be curious. Be curious and find out what it's like.
Jonathan, you've got 30 seconds.
I would say, do you want to work in an environment where you can offer hope in the most challenging of circumstances for some people, when they're at a moment in their life where things are really tough and where they're struggling to find hope? If you want to be in that context, where actually some of the most simple things that you can do can transform to hope for individuals and be part of a great team experience, then give it a go. And bear in mind, you know, you're not stuck in prison forever. There are
No.
loads of other opportunities beyond prisons as well.
Indeed. Indeed. Well, thank you very much. I think one of my colleagues is going to share a final slide that's got some contact details on. We will also be sharing the recording, sharing those contact details. And I think my top takeaway from today has been give it a go, ask some questions, give some hope, give it a go and get in touch. Thank you so much, everybody, for joining us. Bye-bye now.
Bye.
Thank you.
Bye.
Bye.
Bye. Bye. Bye.